We're each going to speak briefly about four things. First is the not-for-profit landscape more generally. Secondly, the opportunities and challenges that we see. Thirdly, what we believe WAPHA can do to support the community sector. And then fourth, the reverse, what we can do to support WAPHA in that endeavour. And I think it's fantastic that WAPHA have, as we've been hearing this morning, this sort of expansion, broadening of the perspective across what is going to lead to a healthier and happier Western Australia, which goes way beyond clinical services. And so it's really good to be here representing those many other parts of the system, if you like, that lean into that. So first of all, I'm going to kick off with Lou, just with some observations on the landscape for not-for-profit organisations.
Thank you, Dan. Is that on? Dan and I thought we should live this about working together in collaboration, and I actually sit and work with Dan on a couple of boards, including CEWA and the Supporting Communities Forum. I just want to touch base firstly about the not-for-profit environment and what it looks like for the community service sector. But grounded in that, I don't think any of us can forget the community service sector, like government, isn't an island. We don't work in an environment like this silo that excludes everything else. The community service sector sits within the environment of the community and the people in which we serve. We are part of the community. And you see that often more and more when you go out more and more regionally over how entrenched the NGO or the community service sector is within the community. And it does happen here as well. So that's just a reminder, we're not an island. We are part of the bigger environment in which we all work, live, love and play. So what's the environment currently like for the community service sector, or where a lot of us work in this room right at the moment? I'm really glad it's Friday because I really need a weekend. And I think it's already been touched base on that we've had a number of reviews and there's a number of reforms that are actually happening at the moment. So there's enough being said around the Sustainable Health Review. And I'm going to mainly talk about a state level, not so much the federal level. So we had the Service Priority Review. We've also had the government reform of the MOG, of bringing together multiple government line agencies. And a big impact for the community service sector has been the Department of Communities and how that's reformed, that now has housing, homelessness, disabilities, women, youth, aged care, communities. The list goes on and on and on. And I was at a presentation there a couple of weeks ago. It was an internal piece of document they showed us. They've got currently just this one government department, which is now the third biggest state government department, over 6,000 employees. They've got 18 strategies under development at the moment. And that ranges from housing, homelessness, family and domestic violence, youth, elder abuse, the ACO strategy, building the capacity of Aboriginal organisations, a women's plan. They go on and on and on and on when you actually look at them. Now that's having a massive impact. I do feel for the people who work in that department to have that many strategies and that many consultations that are actually occurring out in the community at the moment. But that raises a lot of questions for the community service sector. How do they intersect? How is that homeless strategy working with the housing strategy that's working with the FDV strategy? And that's just within one department. How is it working, intersecting with drug and alcohol, mental health, education? And the community service sector is engaging with those reforms and those strategies at the moment. So there's some really big pieces of work that's actually going on at the moment across government line agencies. But I want to bring this back to the environment in which we're all working on. We've had this state government for 2 years and they've developed a thing called Our Priorities, and there's 12 targets underneath those priorities. But one of those targets is about getting the budget back into the black, repairing the budget. It's the only one that's not client-centred. So, and we've heard, I'm sure many of you have been to many forums where you've heard about the state of the WA budget, which is true. It's you see the figures, it's very, very real. And that's a real driving force behind their priorities. So whilst we're building a whole bunch of strategies, and I think there's $5.5 million in the state budget that's going back into DPC to help with all the reforms and the strategies, we're yet to see how that's implementing the communities in which we're serving. We've got increasing poverty, we've got increasing inequality, FTV is through the roof. So there's really good intent, a lot of strategies at the moment, but we're not seeing how that's translating to the people on the ground. And the feedback WACOS is getting from our members is just increasing demand on our services, increasing number of people who are presenting with issues in a very, very complicated system. So that's the environment we're all working in the moment. We're all wanting to work together. We're wanting to see these fantastic strategies come to fruition, but when is it going to start impacting the people who are most vulnerable? Over to you, Dan.
Yeah, thanks, Lou. It certainly is very complex, and as a not-for-profit, trying to grapple with all of these different layers of reform is one of the big challenges, which I'll come back to in a minute. One of the things I am involved in is the Supporting Communities Forum, which is, some of you will know, there used to be a thing called the Partnership Forum, established by the Barnett government, and the McGowan government has basically sort of continued it, but in a very different form. The basic concept of this forum is to bring together a number of representatives of the community, of which I'm one, many of which are CEOs of not-for-profits, but some of which are members of the community more generally, alongside of half a dozen of the key directors general from various state departments, which all work in this community kind of space. The reason I'm mentioning it is that I believe what is behind the Supporting Communities Forum is quite a unique idea, which is that there is a different way of working where the state government and not-for-profits can do things that one or the other can't do without them. And more generally, where we end up in our various conversations and working parties that Louise is involved, I see John Ford's here as well, and there might be some others who are involved, is we get back to this, and Pip, just before you waved, it reminded me, because where the conversation inevitably gets to is how are we involving citizens in these initiatives. And for me, where I get a little bit of optimism around the messiness of the reform environment at the moment, is that I actually believe there is both an opportunity and an interest at government, not-for-profit, and in citizen land of doing things differently, of working differently, really bringing the voice of the people into the way that reform is done. And I think if we can focus on that and be genuine about it, move past the hyphenated expression of co-design and all of these words that get bureaucratised and then immediately lose their meaning. If we can move past that and genuinely engage people, authentically engage people to be involved in what is going on, we can cut through the bullshit, to be honest. And that's, I had to think about whether I was going to use that word. But there is a lot of cutting through that can be done. And if you sit down and have an authentic conversation with the people who are involved and give them some power in how those reforms are put into practice, you actually can cut through. We've heard today a little bit about many of these factors that do drive and associate with poor health and utilisation of the health system. And that quote from Nurse Watson was just, I've actually tweeted it already. This existential kind of crisis that many people are in is absolutely at the heart of many issues. And actually, I've seen some research recently where the mortality effect of loneliness is equivalent to smoking 15 cigarettes a day. So it's actually up there with one of the biggest predictors of early death and a whole lot of comorbidities. And so through the chorus perspective and what I've just been saying through things like Supporting Communities Forum, finding a way to properly engage people in their own situation, their own life, give them a sense of belonging, a sense of purpose, maybe we can chip away. And I think the not-for-profit landscape would do well to shift in that direction and be led by the people we serve rather than leading and pushing our services at them. Which brings me to our second theme around opportunities and challenges. Just three things to mention. The first is Chorus is heavily involved in supporting volunteers to get to be part of what we do. And I actually think it's Volunteer Week today, this week, and there was a big awards night on Wednesday night, and we had a breakfast for Chorus volunteers on Tuesday morning. I really do believe that volunteering and volunteerism can be the engine of the changes. So this is an opportunity here to go back. Some of this stuff is going back to old sort of paradigms of making a community contribution. We recently did a podcast about loneliness, and we interviewed a psychologist who, I'm not sure whether it was heard a quote or she'd bought it from somewhere, but she said, it's physically impossible to feel lonely if you're in service of somebody else. So as a path to re-engaging, volunteerism is a really good opportunity. It's a really quite often quite forgotten or treated as a bit of a side project. But in this state, we actually have a Minister for Volunteering, Mick Murray. There is a recognition in the Department of Communities. There's a framework. It's actually really important. It sounds a bit old school, but there's a path, there's an opportunity there. So that's just one I wanted to mention. The second area is a bit of a challenge, and this is a bit for the Community Employers WA Board, around employment. And in the not-for-profit sector, particularly, and we're involved in aged care, disability, mental health, we have a workforce which is, as we've saw a little bit of, it almost made it onto the agenda in the election campaigns. These people are not paid particularly well. A very large majority of them are women. Historically, industrial instruments have not treated them particularly well. And where the squeeze comes on, when we're being pressured around cost indexation, short-term contracting, for example, in the mental health space where contracts are always short-term, you just breed insecurity and inequity in the employment arrangements. So I feel like it's a real sort of moral challenge of our time that on the one hand, like all not-for-profits, Chorus is being squeezed financially to be more, to perform more sustainably from a financial perspective, which basically means more efficiently. And then at the same time, knowing I'm already paying our frontline workforce $23, $24 an hour and offering them, minimum hours contracts and things like that. So you absolutely feel like there's this squeeze on. And I think those of us in this room who have some influence over the levers of funding need to understand that where that ultimately hits is frontline workforce, who are then the people who supposedly we are empowering and engaging in doing things differently. So that's a real big challenge for us. And the third one is the one that Lou's already mentioned around this volume of reform. And what that leads to is great uncertainty in provider land. Chorus is the product of that uncertainty because we were a merger of three. It's actually done in a very positive sort of optimistic kind of mindset. None of the three organisations that became Chorus were in extreme financial trouble, which is usually what leads to a merger when it all comes down to it. But if anyone's seen the stats that David Gilchrist produces around disability organisations, pretty much everybody's losing money. Pretty much nobody's got much more gas left in the tank. So we absolutely are going to see consolidations and mergers and things like that. So in Chorus, we talk about the layers of uncertainty that we have. We're trying to merge as three in a highly changing reform environment in a global world which is increasingly volatile and uncertain. So it's a really challenging place to work. But I'm still an optimist. So how about you, Lou?
Yes, I am, and I'll finish with something optimistic because I don't just want to be seen as a pessimist on the stage, but just to back up what Dan said there, it was about 2011-12, the Equal Remuneration Order came in, which saw up to a 45% increase in the wages for our staff, and that was based on gender. Predominantly, our workforce are female and they were being underpaid without a doubt. But the squeeze has come on and on and on our sector, and it was prior to it was Colin Barnett's government, and now we've got the McGowan government, and their lack of recognition about our legislative responsibility to pay our staff appropriately. So organisations are having to make a really hard choice. Do they then reclassify their staff roles? So once upon a time we had a level 4 or a level 5, but we're going to bring that down to a level 3 because they're stuck in a really hard place. They don't want to impact the services. They don't want to see their services being cut back because there is increasing demand for those services. Do they do that, or do they keep true to the intent of the Equal Remuneration Order and keep the salary of those staff at level 5 instead of 4 or 3, but then cut back the services to those they face? So they're really in a hard place at the moment in relation to that. And it's really hard to track about the total impact that's actually having on services. So that's why Dan and I are both part of CWA, and it's a big part of WACOS's role. We do a lot of advocacy around that because ultimately in the end, the people we serve on the ground will be the losers. Because if you are going to start paying your staff less, you're going to start having less qualified staff as well. But I do want to say something positive about sort of the current opportunities that is happening in the not-for-profit sector at the moment. There's a lot of self-organising going on at the not-for-profit sector at the moment, and there's a couple of examples that I can give you. So these are leaders within our community service sector that are coming together to look at combined solutions they are really parking their logos at the door and looking at the issue and how do we collectively and collaboratively come together to find those solutions. So a couple of them, Pip mentioned in her slide, was 100 families. A lot of good ideas are coming out of New Zealand at the moment, including having a female Prime Minister. But they came over to WA, they presented 100 families. We've picked up that project. There's about 8 partner organisations that are really looking at entrenched poverty and why people are stuck. But the whole design of the project has been designed by the people with the lived, I can't find a better word, the people with the lived expertise. They're paid for their time, they've designed the survey, they're part of it every step of the way. We've got things like the End Homelessness Alliance, who are doing a magnificent job of actually bringing in not just government but the broader community and bringing together also the corporate world and their responsibility to end homelessness in this state. There's a massive amount of work going around on food security, and there's a real collective around that. Nobody should go hungry in this state. Everyone should have good food. There's plenty of it, but there's plenty of people going hungry and eating bad food. So how do we bring in that corporate world who have all this fresh food? And we're talking about tax breaks for them to make sure that, that food can be transported around the state. And of course, we've also got the Noongar Family and Child Wellbeing Council. So this is a collection of Aboriginal leaders who have come together, who are looking and working on solutions and bringing their power of their voice together for the overrepresentation of Aboriginal children in our out-of-home care system, which is up to around about 56% right now. These are all self-organised, and none of them started with any funding. Some of them now do have funding, but it came through the will and the leadership of those leaders in the community who said it's about time and we want to stand up and do something. They're just some. There's a whole heap more, but they're just a couple. Oh, now...
Flowing smoothly.
Flowing extremely smoothly. The third topic was... How can WAPHA support the landscape into the future? So one of the things that we would like WAPHA to do, and I know it's actually in the plan, but really listening more to the voices of Aboriginal people in place. It's now called co-design, or co-design is the word that you've heard bantered around, or place-based solutions. But it's what Aboriginal people have been talking about for so very, very, very long. It's the Uluru Statement. It's about self-determination. They have the solutions. They live within the communities. And if we aren't willing, and I say we, because I'm a non-Aboriginal person, that I do have a lot of power and influence in my role, if we're not willing to actually get that up, take the real risk and let go, we're never, ever, ever going to see the change. So it has to be led. So it's how much we're willing to drop our risk appetite or broaden it, because I don't think it is risky, because some of the things that we've been doing for many generations, we're not getting the outcomes that we need to be getting. We know the situation's actually getting worse, so it's time we actually did something different. So that would be one of the key things. So I'm not sure how that's being done in WAPHA at the moment, but sort of really having those Aboriginal-led solutions and really basically throwing away your rule book, because our whole system, our whole structure, how we tender, how we commission, favours non-Aboriginal organisations. It's all done very much through a white lens. So that would be number one. Over to you, Dan.
Thank you. Thanks, Lou. My ask of WAPHA really is boils down to two things, and I think you've heard from Leanne and Anne and Richard this morning. These are absolutely what the plan says already, right? So just to reinforce things, and I think that ultimately come back to culture, because as we saw from the pie diagram that showed WAPHA's, sort of in dollars terms, its role on the landscape is a tiny little sliver. But what WAPHA can do as an organisation that came together organically, multiple parties collaborating, doing something really quite different, and now operating in quite a granular and organic way out in the community, is change culture. And so I think ultimately this is a cultural challenge, just like the Sustainable Health Review identifies that ultimately reform of the health system in Western Australia is a cultural challenge. So there are really two things that I would suggest. The first is about the clarity that you can provide in terms of the longer term direction, the sort of the narrative or the vision or the framework that we're working to. And you've heard Leanne talked about a number of them this morning. I absolutely, and have got recent experience through the mental health community, mental health space, around how much of a rock and a hard place WAPHA sits between the Commonwealth Government out of Canberra and providers, and then ultimately customers or clients of our services. It's an incredibly difficult spot to sit in because you don't get the certainty that you need to provide us with the certainty that we need to really commit to a longer term. But having a longer term directional or framework enables us to participate and build capability, build momentum. And again, use the mental health or the psychosocial disability space. It's been fraught with uncertainty over contract length, funding length, frameworks change bit by bit. Organisations like Chorus and a couple of others in the room, you know, it's very difficult for us to build really strong and deep capability in that space. And then we wonder why the community mental health space is fundamentally fragmented and disconnected. Well, there's not a lot from a business perspective that enables us to build any real sense of permanence and certainty in that space. I actually think the NDIS, with some help from us, can be a game changer in that space because it's perpetual. Eventually, the rules of engagement will become reasonably well understood, and we can really use that to the advantage of many people living with mental illness in the community. Again, I said I'm an optimist, and I know we've got some work to do there. So I think having some framing which is long-term would be extremely valuable. And the second thing, again, I know that you're committed to it, is the openness and the collaborative approach that you bring. And I think as providers, that's a culture shift as well. We're mostly used to being told what to do, being given a contract. It's all very black and white. Both WAPHA and providers need to come to terms with the way. We've seen the model. Commissioning is fundamentally a partnership-driven way of working, which is very different for most of us who over decades and generations have learnt that you basically get told what to do and then you do what the money says. That's not the way we want to work. It's much more collaborative and open. And I think that the Sustainable Health Review, what was your phrase, Pip? A diet is not weight loss. You know, we've still got lots of work to do, but it absolutely points the direction about how we need to join the dots and work collaboratively. So our commitment as Chorus and my commitment as a participant in this system is partnership. And it's such an overused word, and I just wish bureaucratic systems didn't grab words, because the minute that happens, it's gone and it slips through your fingers. But it's an authentic, genuine relationship between ourselves, WAPHA, and other players, where we're here to do the right thing. You heard Louise talk about examples of where providers leave the logo at the door. That is what we've got to do. And all of us, actually, when you look deep inside yourself, probably you will see that you're not very good at leaving your own logo at the door or your company's logo at the door. So it's a genuine commitment to partnership, warts and all. We'll tell you how we're going. And we'd look forward to you telling us how you're going and what's required. The second thing is definitely in this broad psychosocial community mental health space. It's a specific area of focus for my organisation. It's a big area of need. I actually see some opportunity in all of the fluidity that's going on. So that's a particular area that we're committed to working with WAPHA on. And leveraging, you know, Commonwealth funding, leveraging other programs into a good outcome, notwithstanding that the actual amount of funding we're talking about in terms of the conversation with WAPHA is relatively small. And the third area we commit to is this philosophy of local and place. And Lou just talked about it, you know, and we can learn an enormous amount from the way that Aboriginal people talk about their connection to community and to place. And at Chorus, we are really trying to find ways of reimagining our organisation, which actually operates locally and with a place kind of orientation. Again, it's another one of these ideas that's lost some of its meaning because it gets so overused. But I absolutely believe that people live their best lives when they feel connected to each other and the place that they belong. WAPHA talks about it, we talk about it, let's put that on the ground. So that's our commitment.
I think there's clearly demonstrated that WACOS and WAPHA, we're a member of WAPHA, want to actually work together. I think there's real opportunities at the moment. It's just yesterday, as a member of Supporting Communities Forum, we've been asked how can we improve our, give examples of where it's working, where it's not working well, the state and Commonwealth relationships, and sort of putting that forward of how we can actually be working together better. And I think there's an absolute commitment, and it is about relationships, and it is about parking your logo at the door and never losing sight of why we're actually here. because sometimes all the bureaucracy, all the red tape, all the exhaustions gets in and we start losing sight. But if we always bring it back to the client, why we're actually doing what we're doing, that's when partnerships will actually be achieved. And I'm always up for a really heated, robust conversations. Thank you.